Meantime, public health experts in the U.S. are worried that 4th of July celebrations could fuel the current surge of infections. Experts say this long weekend will be a crucial test in self-discipline across the country. Cases are spiking in 40 states, and many governors have ordered masks be worn and are asking people to stay at home to celebrate Independence Day. The U.S. set a new record yesterday with over 52,000 new infections. And for more on this, let's bring in infectious disease professor and outbreak response expert, Dr. Aileen Marty. Dr. Marty joins us from Miami Beach, Florida. Thank you so much for joining us this morning.
Pleasure.
All right, so Dr. Marty, what is the current situation in Florida, and are the restrictions there in place?
We have some restrictions in place, and we've ceased our reopening efforts. We still don't have a statewide mandatory use of masks. However, in the county where I am, Miami-Dade County, we do. But my county is one of the hardest hits. Mm-hmm. We have a third of the deaths right here in our county. And we have an excellent mayor here who is quite knowledgeable and aware of the scientific aspects and the way to look at this problem. So we're focused on where are the cases coming from? Mm-hmm. So one of the things that we've been criticized about is the reopening. And so we looked very carefully, where are our cases coming from? And our cases are coming from home parties, graduation celebrations, birthday parties, those sorts of issues. So we imposed the types of restrictions now with our cases going up where we would impact where things were happening. And that's why we now have closed the beaches for the July 4th, and we have also started a curfew that starts from 10 p.m. at night until 6 in the morning to try and get a handle on that and get mm-hmm. people home before they start consuming substances that make them lose their judgment.
Absolutely, I understand what you're saying. Well, with over 40 states having an uptick in the number of positive coronavirus cases, are you expecting a surge in cases for the July 4th weekend? Because as you just mentioned, it's the birthday parties and all the events that people are having, which is causing those numbers to go up. So do you think people have the discipline to stay inside?
So it's not about necessarily staying inside or closing businesses or anything like that. It's how we behave when we are not within our own home. It's that interaction, all the things we now know that we can do to reduce the transmission from a member of one household to a member of another household. And so we're focusing the message right now on behavior, using masks, keeping the 6-foot distance, the hygiene, the respiratory etiquette, so that people understand that they just can't hug Uncle Charlie mm-hmm. or whatever it is, that for right now, we have got to do everything in our power to reduce the transmission of this virus so that we don't have to impose further problems. Right now, our hospitals are at 74%, our ICU beds. Mm-hmm. That's alarming. And we're headed in the wrong direction, so we really need to get back in the right direction.
Absolutely. And now this has been going on for months, since March. Now with the virus surging, we're in July right now and spreading. Do you think people are starting to feel a little helpless, a little lost right now?
There's been a lot of mixed messages and a lot of crazy viral videos that have led to a lot of people being very confused about the nature of the virus, the risk from the virus, and what they can do. So despite the best efforts of those of us who are trying to explain the science, follow the numbers, and do the right thing, there's just way too many confused people mm-hmm. who are sick and tired of being at home. Mm-hmm. And they don't understand what they should do to be able to have both an open economy and fight the virus at the same time. And that's the message we're trying to bring.
Mm-hmm. And earlier this week, there was a story that hearing about parties where people are intentionally trying to contract the virus to gain herd immunity. What are your thoughts on this, especially for the young people who think that they can't catch the coronavirus?
Well, first of all, anyone can catch the coronavirus. It's what happens to your body after it's in there that differs because of your age or your underlying conditions. or just the bad luck of having received a really high bolus, which is what these people are exposing themselves to. So the bottom line is, these people who are asymptomatic from the virus, 67% of them show changes on their x-rays, even though they feel great. So we don't know what the long-term damage is from that event. Second of all, we also are trying to understand whether or not people actually develop any significant response. And the data right now, certainly the antibody data, doesn't lead us to think that once you've been exposed, you have a permanent immunity. In fact, quite the opposite. Antibodies are lost within 2 to 3 months. So these people may likely be reinfected, and that reinfection may likely be worse than the first, and a third time worse than that. So these people are taking huge risks with their own lives, let alone the fact that they're exposing people who have underlying conditions and are older to even higher risks. It's really unconscionable.
Very sad situation. Well, I thank you for your insight. From Miami Beach, Florida, infectious disease professor and outbreak response expert, Dr. Aileen Marty. Thanks again for your time.
Thank you for having me.